Does it feel like your little one has been caught in a never-ending cycle of sniffles, rubbing their eyes, and restless nights? It is heartbreaking to see your baby uncomfortable, especially when you are not sure if it is just another daycare cold or something else. Today, we're talking about environmental allergies. We will help you identify the triggers and give you practical strategies to help your baby breathe easier. First, let's answer a common question. Can babies even have environmental allergies? The answer is yes, but the timing depends on their age. For babies under 1 year, true environmental allergies are actually quite rare because it takes time for the immune system to sensitize to the world. Between 1 and 2 years of age, you might start to see the first signs appearing as they spend more time interacting with their environment. By the time they reach 2 years and older, full-blown symptoms often emerge as their bodies react to seasonal changes and indoor irritants. So, what exactly are these babies reacting to? There are 5 major environmental triggers that parents should keep an eye on. The first is dust mites. These tiny creatures live in bedding, carpets, and upholstered furniture, and they are the most common year-round trigger. Next is pollen. Depending on the season, trees, grass, and weeds release tiny particles that can irritate your baby's nose and eyes. Pet dander is another big one. Even if you don't have a pet, dander can travel on clothes into your home and school environments. Mold thrives in damp areas like bathrooms or basements. If your home has had any leaks, mold spores could be the hidden culprit. Finally, even cockroaches can leave behind proteins that trigger allergic reactions in sensitive infants, especially in older urban buildings. Now, how can you tell if it is a cold or an allergy? It can be tricky because the symptoms look so similar. A cold usually lasts 7 to 14 days. If your child has a fever or thick yellow mucus, it's likely a viral infection. Allergies, however, can last for weeks or even months. There is no fever, and the mucus stays clear and watery. Watch for itchy, watery eyes and frequent sneezing. If the symptoms persist past 2 weeks, it is time to consider environmental factors. Managing these symptoms starts at home. One of the best investments you can make is a vacuum with a HEPA filter. For the nursery, use zippered, allergen-proof mattress and pillow covers. These create a barrier that dust mites simply cannot cross. During high pollen seasons, keep the windows closed and use an air purifier to keep the indoor air as clean as possible. Bathing your baby before bed can also wash away any pollen or dander they picked up during the day, preventing it from getting into their bed. If you suspect allergies are the cause, your pediatrician might suggest a skin prick test or a RAS blood test to confirm triggers. When it comes to medication, always consult your doctor first. Saline sprays are great for clearing out allergens naturally. Be cautious with over-the-counter meds. Avoid decongestants and only use antihistamines that are specifically approved for your baby's age. I know how exhausting this can be. You are doing a great job navigating these hurdles for your little one. If you found this guide helpful, please like, subscribe, and check out our Bump to Baby guide for more parenting tips. See you next time.